Okay, well, welcome everybody to our awesome webinar for February Heart Health Month. What's living in your mouth may be living in your heart, the oral DNA heart connection. And we have with us today Dr. Jill Wade and Dr. Gina Pritchard, and longtime friends and, practitioners together in this journey of wellness. Dr. Wade, if you don't know who she is, she's a dentist in Frisco, Texas. She started the Smile with Heart program, which is focused on the oral systemic link and finding hidden dental infections and periodontal disease to help prevent heart disease, amongst many other things. Dr. Gina and Dr. Wade work together at Relevance Total Health, which is also in Frisco, Texas. Dr. Pritchard is an acute care nurse practitioner, especially in cardiovascular prevention. She is the owner of the Prevent Clinic with offices in New York and obviously Texas, with Dr. Wade at the Wellness Center at Relevance Total Health, and the clinical program director of the Bale-Donine method, which we're going to get into a little bit more throughout this PowerPoint. So very passionate about prevention for cardiovascular disease, preventing heart attacks and strokes. So I'm going to let you ladies take it away from here. I'm so grateful that you're able to educate us on something that's very, very important. So.
Absolutely. Welcome, everybody. I just want to echo what Aurelia just said, which is this is very, very passion topic for me, very close to my heart, all pun intended on that one. Gina and I were actually just spending a couple of minutes together earlier this evening, and we were just reminiscing about how long we have been so passionate about this particular topic. I mean, we're in our second decade now. So this isn't new to us, but I still feel like we both have as much passion for it today as the first time that I ever met Gina. What do you think, Gina?
Absolutely, absolutely. Our passion has not diminished in any way. In fact, we're even more excited than ever because we have better tools and a better understanding of what we're doing. So, yeah, it's an exciting time.
And that's really what we want to bring to the table for everybody tonight is those tools, some of our knowledge. We don't necessarily, the goal is not to jump down into the science uh just enough to get you enough knowledge to understand what we're talking about, but really to just share some tools that we now have, like she said, that you may or may not know about.
Yes, awesome. Well, let's get to it.
So Gina and I both studied under two amazing people, also good friends of ours, Dr. Bradley Bell and Dr. Amy Doneen. And one of the things that you may have heard or seen about at some point, if not, I highly recommend that you get this book. It's Beat the Heart Attack Gene. And I'll have Gina tell you why she thinks this should be in everybody's house library. This is a tool that everybody should have.
That is for sure, because they were the first, I say, to get me out of the hospital. Before that, I was in ICU the whole time, but beginning to wonder what is out there that we can do to actually keep people out of the hospital. And it was when I first heard Dr. Bale and Dr. Doneen speak and talk about many of the things we're going to talk about tonight. I said, there is so much more we can do to not only prevent heart attacks and strokes, diabetes and dementia, but reverse the process. So if someone has had the disease or does have the disease, we can stop it and reverse it. And that's what this book is all about. It explains it in great detail.
I think, and really up until the point of that particular book, people, and I still don't think people realize that you actually can reverse the disease.
That's
I,
right.
I just, I just don't think people even realize that. I think they think once they've had the damage or, once they're on those particular meds, there's no way that they could get off of them. Do you still agree with that, Gina, or do you kind of disagree with that these days?
I do agree that that is the common opinion out there for sure. I run into it regularly, as I'm sure you do. They, so many people just have been inundated, as were we. We were taught once you have that diagnosis, you always have that diagnosis. Yes, you may still have, we can see where the disease is, but we can stop it from continuing to threaten a crisis in the future in your life for sure. And I would bet there's way more people that believe it's not possible than people that believe it is, just
Right.
because I run into resistance a lot.
Right.
So open your minds, everyone who's listening today, and say, if there's a possibility, I want to understand why it's not happening on a global scale. That's what Dr. Wade and I are trying to sing from the rafters and the
Right.
rooftops.
Yes, absolutely. Um, what lives in the mouth affects the whole body. We say all the time, anytime I'm on the lecture circuit, I'm always talking about how the mouth is a window to your health, what we see going on. Inflammation, specifically bleeding gums, red puppy bleeding gums, that's inflammation. And that can be because you're not doing a good job brushing. But there are some people who do a great job brushing and still have a lot of inflammation and gum disease because the bacteria itself has really incorporated around the teeth, diving deep underneath the gum line. And then because the mouth is so vascular, it goes straight into the bloodstream. And we now know, and I'm sure we'll talk about this more in this lecture, that certain types of bacteria, four of them specifically, are really, really bad bugs, really devastating bugs. Not only can they destroy the bone around the teeth and create all this inflammation and bleeding, but because it's in the bloodstream, and this is where Gina can take it, it actually is part, I guess you would say, of creating some of the disease and inflammation that's in all of the blood vessels in your entire body.
That's exactly right. Yes. And this picture is trying to demonstrate that high percentages of these diseases or these this like a future that none of us want because a crisis is in the future if we have any of these in our future. So it all starts, as you just said, in the blood vessels. And so on the next slide, we've got a beautiful example of this. And the authors of the book that we just talked about, Dr. Bell and Dr. Doneen, as well as the third researcher, Dr. Dave Vigorous, has outlined for us beautifully how can something in my mouth affect my heart or affect my blood pressure or affect my blood vessels or affect my brain. You know, I go to the dentist and the dentist is doing their thing and I brush and floss just as you said, Dr. Wade, but they get into the circulation. And when they do, they take up residence in the wall of the blood vessel. And that's where they can be life threatening. All of that's silent. You don't feel it, but it's happening.
Absolutely. This is a great picture of what she actually just said. So you have all these blood vessels, and we know that, I think my grandmother used to say, I've got hardening of the arteries is what she used to call it, right? And it was just this concept that I think people didn't know back then. No, I don't think anybody really exactly knew, but they knew that the arteries would get blocked and quote turn hard, and that's why I think they called it hardening are the arteries. Gina and I now know we'd almost rather have something that was hard plaque inside the arteries than soft plaque living like in the walls of the arteries and creating inflammation in the arterial walls, because that's actually more at risk than if it's turned calcified, right, Gina?
Right. Absolutely. Yes. And these pathogens, as Dr. Wade said, that can live up under the gums, and you may look fine, your teeth may look fine, your exams may be fine, but you don't know that they're there unless you go looking with a test or something like that. And when they get swallowed, they can go with along with the nutrients and the other things that go through the GI tract and get into our blood vessels. And then once they're in the blood vessels, the body starts to accumulate them in the wall of the artery, just as this picture is trying to depict.
And I think too, there's no coincidence that we call plaque around the teeth and plaque in the arteries. It's not a coincidence that we call it the same.
That is right. There's plaque in the mouth is plaque on the heart is plaque on the brain. I mean, it's everywhere.
Brain.
Yeah. And that's why you say it's the entry point, and it is.
It
The mouth
is.
is the entry point. Yeah.
So, hidden dental infections. We were just talking about gum disease, periodontal disease. Again, my grandmother used to call it trench mouth. I mean, you can call it a whole bunch of different things, but you can have basically a tooth that is still alive and still lose a tooth because of periodontal disease. But what can be really tricky, and this is what we've learned all these years in Beldonine, that you cannot always um, think that we don't have disease happening in the mouth just because it doesn't hurt. Periodontal disease does not hurt. And sometimes even hidden dental infections do not hurt. Because just like this picture depicts, the tooth itself died at some point, had a big cavity in it or whatever, died at some point and got a root canal. That's the little white line showing right there in that x-ray. But they ended up having a secondary infection, a hidden dental infection at the top, which looks, it's inside that little red square that looks like a dark circle at the tip of the root, which we call the apex. And there's only certain types of x-rays when we take about every 3 to 5 years that show the tips of the x-rays. That's why when you have somebody say you need a full mouth series of x-rays or an FMX, the one that's like more like, anywhere from 15 to 18 to 20 x-rays, individual x-rays, do say yes to that. This is how you find these hidden dental infections. That way or with a 3D cone beam. They do not have to hurt, but they can be a constant. And when I say constant, I mean 24/7, 7 days a week, every month, every year until it gets taken care of. And if that constant infection is incorporating bacteria into your bloodstream, you are sick and your immune system is dropped because of that. And then the body starts reacting to that, which is part of, I don't know, guys, if we have kind of the reason why it all happens, but I'm sure Gina could quickly kind of explain that there's a reaction of the body to that type of inflammation and that type of infection, which is what can trigger an event, a stroke, or oh, I love this picture. Yes, I love this one.
Yeah, I think this is what you're
Yeah,
referring to, Dr. Wade.
it is. It is. It is. So as you can see with that picture from left to right, you go from the left side into a healthy artery and a healthy wall of an artery. And then as you progress to the right, it's not so much that, yes, the lumen, the little circle inside the artery does get smaller, but it's more because of what's happening in the wall and that the wall is getting inflamed and getting larger, which is creating a smaller lumen space, right, Gina? And then if you want to, why don't you explain like where the real event happens?
Right. So somebody, oftentimes people wonder why they can be fine this morning and then having a heart attack at the hospital this afternoon. And the reason is because as plaque is laid down in the wall of the artery, as depicted in this diagram, it does grow, as you've said, Dr. Wade, but if it's soft, you alluded to that earlier, and it's not a stabilized hard plaque, ultimately it takes time for a plaque to become a stabilized, I say scar tissue plaque, because when plaque starts to form initially on the wall of the artery, it's in this middle category. It's just starting to develop. Think of it like a little sore on your hand, and you're like, oh, that's kind of growing. Maybe that's getting worse. Maybe it's getting better. I'm not sure yet. Think of that. It's a lesion on the inside of the wall of the artery. And at first, it's kind of just this ooey gooey accumulation of things. And so it can go, I say, right or left. If it goes to the left, it becomes a scar tissue and it will never become a problem the rest of your life. If it goes to the right or the other direction, whatever I said, then it can become more inflamed. Think of it like that lesion on your skin that is becoming infected, or a blister that's growing, or a pimple even that's growing instead of going away. So it starts to become more inflamed, more what's called oxidized. And when we talk about inflammation and oxidation, these are the two things that we talk about the most that are occurring at the wall of the artery. Think of inflammation as fire. It's a flame, a little hot spot in there. And then oxidation is just a huge fire. It's like inflammation that is just growing and growing and getting worse. And when that happens, that plaque that was just laying there, really not doing anything other than maybe growing a little bit, can rupture. And that's what is being demonstrated there in that next to the right part of the artery, where it looks like there's a little fountain coming out of the wall of the artery. Yes, that right there. That little plaque, if it remains soft with kind of a thin layer on top, it can burst, just like a pimple can burst or can be popped, or like a blister can burst, or our wound on our skin can start to ooze. When that happens in an artery, we don't know it's happening. Again, it's still silent, and the body reacts by sending in an immune response and a blood clotting response. Because our body knows if it doesn't take care of that sore very quickly, then the body's next step is to put a blood clot over it so that it stops leaking. That's why we call these leaky arteries. It ruptures and this contents start to leak out. So it happens within seconds. The body sends in all of the cells that we need to stabilize that plaque that's starting to spew or starting to leak a little bit. And then comes the blood clotting mechanism. So you're fine right now. This happens, then a blood clot forms. And rather than just forming a small blood clot, which can happen and you never even know anything's occurred, oftentimes a big blood clot continues to build in the wall of the artery. So, and that can occur over a few seconds. So that's why this artery starts to leak. It's inflamed and oxidized beyond repair at that point until someone can treat it. And then a blood clot tries to seal it over. And that's when someone starts having chest pain or has, unfortunately, in 40% of the cases, the first clue that they even have vascular disease, they can have sudden cardiac death. The heart can just stop because it's not getting the blood supply. So that's why the blood clot is there, demonstrating that it's really ultimately a blood clot that leads to a heart attack. And it's not just more and more accumulation of the plaque.
And the
What
back,
a great explanation of that. That was
yes,
perfect.
I know. And so as when you have periodontal disease or a hidden dental infection, your body's in constant inflammation because your body, I like to say, is like, hey, I'm going to go kill this bacteria. So you have all these, troops going in, and then the bacteria is getting into the arteries, and your body's responding, which is then causing, those the bacteria to rupture through and the immune system to go up and then boop, dislodge. Is that
Right.
correct? Yeah.
That is correct.
Okay.
Constantly. And I think that's
Constantly.
what everybody has to understand. Constantly.
It's like you're in a constant
All
battle
day
when you
long.
have inflammation
All
and,
night long.
all
Yeah.
night long. Yeah.
Yeah,
Day after
exactly.
day after day.
24.
Until the root cause of that inflammation is identified and then treated.
Yep.
Yes. And I'll
There
explain
could be
why.
other root causes too, but this
Yeah,
is a huge one.
huge. And it's, I would say, the number one or top three. It's definitely in the top three of ones that are missed. It's not even looked for, or if it's looked for, it's not thoroughly treated or correctly, comprehensively treated. You don't want to go part way with this. You've got to make sure that you take care of these appropriately. But I'll also explain why we've called this the cat in the gutter. We didn't call it that, but again, Dr. Bale talks about this plaque that's sitting on the wall of the artery reminded him of a cat that he saw one day when he was at a restaurant eating on the patio. And the cat was in a gutter that was beside the patio, just watching the birds. The birds would come in and try to find particles of food that people had dropped. And the cat would wait for just the perfect time to jump out of the gutter and grab a bird, hopefully. And that reminded him of how this plaque doesn't just stay in the wall of the artery. If it's soft and starts to leak out at the appropriate time, it can just leap out suddenly and form a big clot, and reminded him of a cat in the gutter. So it's clever. It may help us all remember that we don't want any cats in the gutter.
Yeah.
No cats in the gutter.
And
And
luckily we
you
have,
did a great job a few minutes ago talking about the leakiness of the arterial walls. That's not healthy. People are pretty, I think, well right now understand the concept of leaky gut. They didn't maybe a decade ago, but now I think everybody kind of understands that concept of a leaky gut. And we
Mhm.
talk about that all the time about how the arterial walls with diabetes and uncontrolled diabetes can get very leaky. We call that the tennis court. And when the tennis court kind of paint like peels up and starts to get leaky in there, this is also very bad, which is why there's such a huge connection between diabetes and cardiovascular disease and periodontal disease. And now we even know to some extent, brain health or brain disease.
Yes.
Yeah. And luckily we have some new technologies to
Yes,
help find out what's going on in our mouth.
exactly.
So we can jump into that. And this is, I love oral DNA as a dental hygienist. This is like the biggest wonderful tool for a hygienist. So because it actually, helps us know what's going on in the mouth, what kind of pathogens are there. So I will let you guys kind of explain that a little bit.
Well, sure. So how can we get a sample of what we're talking about and actually do something with it so it gives us a piece of knowledge? Now, in medicine, uh, medical doctors, nurses are so used to drawing blood, sending it off, getting a lab report back, and understanding that you're either in range or out of range. You're either having a problem with one of these tests, and then that's associated with a particular organ or a particular system. In dentistry, that is not quite the norm for us. We tend to work in visual things, clinical visual diagnostics, x-rays, probing depths. What does your mouth look like? What do your teeth look like? What does your cavity feel like? Things like that. So when oral DNA really came around, I felt like it was a super tool because with a little bit of a swish, so it kind of tastes salty, a little swish for it's over the years has been 30 seconds to a minute, and then you spit that out and then we send that off. We can actually get a report back that tells us exactly which bacteria. You're not sterile, where we don't expect you to have a sterile body or a sterile mouth. There's the right kind of bacteria, and there's healthy bacteria, there's healthy microbiome, all those kinds of things. But what we're really trying to identify, remember I told you there were really 4 to 5 really really bad bugs that are super connected to cardiovascular disease. We want to identify them, we want to identify which ones you have, and then at what level or volume or burden is another word I use. How much of a burden do you have in your bloodstream? So yes, we take the sample from your saliva, but it's a very good representation of what's happening inside the bloodstream. You can see these high risk pathogens, and then the black line. When they are above the black line, that is too high. That is not normal. We need to really really hop in gear and get after it with some therapy and possibly even specific antibiotics in order to get enough of that bacteria out of your bloodstream to actually tap everything down, tap the inflammation down, and get you safe. There's also some pretty bad bugs in the medium, moderate risk, and then over on the right side is more like a candida or yeast, which you have to remember is just opportunistic in nature. And so it's usually always there a little bit, and maybe something we treat. But what we're talking about right now, as far as saving your heart, making sure that your one and only heart is safe, that you're not having an event, that you're not having a stroke, that you're not having a heart attack, then we're really typically more concerned about the high risk pathogens. Obviously, when we got back the results, we would be then beginning to work on your personalized plan. Perhaps it is a combination, and I see this sometimes, a combination of a hidden dental infection and periodontal disease. Sometimes it'll just be a dental infection, and sometimes it may be just the periodontal disease. It's like putting out, we talk about this all the time, Aurelia, right? And I know Gina and I've talked about it before too. Sometimes it's not as easy as you would think to figure out. We have to put our detective hats on, and we have to look hard, and we have to figure out, where is this coming from? And so this co-management that I've enjoyed so many years with people like Gina, who practice medicine the way she does, and preventively, and through this Bell-Donine method that we've talked about, is I couldn't do my job as well as I do it if I didn't have them on board co-managing patients together, because I wouldn't have the blood work that I want to look at so that I can confirm that there actually is a problem with the inflammatory markers being high. Because if the inflammatory markers are high, then I have to continue to put my detective hat on and keep looking for the root cause or source of the problem, because they need me to do my job for them to take care of you. And so it's a beautiful synergy that I've enjoyed for many, many years, saving lives together.
I think you bring up so many great points, but one is just that the personalized plan. I couldn't treat what I'm seeing without working together with you, and you couldn't thoroughly treat what you're seeing without working together because it is so connected. And many times, people want to just have like a protocol that's one size fits all. And this is one situation where it doesn't. You need an individualized plan with two or three providers. I say two or three because the dental hygienist plays, of course, such a
Absolutely.
role. I say it may very well be the dental hygienist that saves your life because
Absolutely.
they're oftentimes introducing the concept of this bacteria in these tests, and they're oftentimes the ones that are critically important to administer some of the therapies and things.
Oh, amen.
Exactly. I mean, there's been many
Amen.
times when we've done oral DNA, as a patient comes in, we diagnose therapy. It could even just be like one area in the mouth that's challenging or has a deep pockets where bacteria is living in it. It doesn't mean the whole entire mouth is like that. I mean, in my own personal experience, I do have an area in my upper left area like that is compromised, and my oral DNA came back like, hey, I got some high risk pathogens. And and these are great. I got it taken care of. It was a big deal. And if luckily I don't have cardiovascular issues, but many patients do. And why not stop the burden? Like, let's figure out where it's at. Let's stop the fire. Let's stop the inflammation in the mouth, because that is what we can control. We can control what we're doing in the mouth, going to the dentist, getting cleanings, finding out what's going on with our cavity detecting x-rays, and, our 3D dimensional radiographs to find hidden infections, and learn, and these tools like oral DNA, and comprehensively, you guys together with this synergy create a personalized plan for the patient and treat them well and give them the proper care. So it is
So I
quite
will
amazing.
add one other thing. It made me think about this. It is the month of love. It is February, the month of love. And let's just say you're sitting there and you're thinking, well, it's not me. I'm good. I'm healthy, blah, blah, blah. But let's just say your loved one has had a heart attack or has cardiovascular disease, has had a stroke. In a loving relationship, guys, we are swapping bacteria back and forth, back and forth. So you may be doing an amazing job. You may be fairly healthy right this second. You may be in early phase periodontal disease, and your loved one may be in moderate or late phase disease. So many times, this personalized kind of protocol and treatment plans and that we put together for people, every once in a while I have to step back and say, do we need to treat and have your spouse or loved one, loving relationship come in and also be treated? Because if so, I want to treat you guys at the same time. Because if not, I could do a great job on you. The hygienists do a great job on you. And then you go back home in your loving relationship. And what do you think's happening? It's like reinfecting it. So we can't just treat a person. We have to treat the environment and all the things that influence that environment.
So this kind of speaks on after treatment and therapy and you get your oral DNA, when do you retest again? So as a hygienist, if the patient comes in with periodontal disease or a localized periodontal disease, or even a hidden dental infection, we will do a 3-month test, because it takes 3 months for that bacteria to repopulate, recolonize, and then we'll know if the home care has been done properly too. So that's it, it's obviously a partnership with the patient. And they have to do their part just equally as we have to do our part as a hygienist, which, that's what I am. So we retest in 3 months. So it's very important. And I think it's not being done as much as I would love to see it being done, but at least once a year get tested. Even if especially if you've already had periodontal disease, because you still have bone loss, you still have things that can hide in pockets, and especially if you have cardiovascular disease.
Absolutely. And as we're talking about oral DNA right this minute, but I would move one step further and even say retesting your blood work for your inflammatory markers with your medical provider. I think is critical because a lot of times if they're getting that testing done with like Gina on a quarterly basis or 6 month basis, I want to see those test results. And I would know that if any of those inflammatory markers have spiked or peaked back up again, we may have to put our detective hat back on because we may have a new issue that began to create a new problem. And so I consider retesting as much with the oral DNA as I do with the blood work.
Uh,
Absolutely.
Dr. Gina, what um, blood test do you usually use for that? Is it, for the inflammation markers? Do you have?
So there's five, and there are two that are very specific for the blood vessel lining,
Mhm.
and they have big, long, crazy names. Myeloperoxidase, we just call it MPO, and LP plaque 2. And they're inflammatory markers. You just get your blood drawn, and if one of those are elevated, I say we have a dental emergency,
I
or we
agree.
have a prevention emergency anyway, where
Yeah.
something could be brewing, because those aren't elevated unless there is some inflammation and oxidation in the wall of the artery. And that's how that, Jill and I have come to work together, because I want to see these inflammatory markers coming down, and she wants to see what she's finding in the mouth coming down, the oral DNA coming down. And then for prevention purposes, we want them to stay that way. So that's why retesting is so important, both on the blood and on the oral DNA. So the phone call could go either way, either from Dr. Wade to me to say, oh, I'm starting to see some things. What did the last blood work show? And
Mhm.
I see something on the blood work, and I'll call and say, what did the last exam show, or your last oral DNA test? Because it takes all of us together to protect you, fully protect you, and reverse and stabilize the disease process. There are three others that give us other great indirect inflammatory information that can really help us with the detective work, like you were talking about there, Dr. Wade.
Mm.
We're little detectives.
Little,
Yeah.
yes.
So this is just, stating, how to keep healthy. Obviously oral hygiene, brush twice a day, and floss to remove the plaque in between the teeth. Go get a professional cleaning. Go get cavity detecting X-rays. Just be preventative and proactive. Obviously, we want to make sure we always eat healthy and things like that. Um, and quit smoking if you smoke, all these things that you hear all the time. So these are all just preventative measures. Anything else that you can think of that would be not on this slide, Dr. Gina, that you've come in
One
contact
thing I would
with, or?
say is that these lifestyle support, it's like a vicious cycle, I guess I would say. If someone, let's say, I'm just going to use worst case scenario, has diabetes and their blood sugars are wild, high, low, crazy. Um, it's very difficult. Y'all find it difficult, I imagine, in the dental office to effectively treat, or maybe you can effectively treat, but then it won't stay that way. And the same is true in what I'm seeing in the testing that I'm getting. And oftentimes it's because the person is working against their own health by the choices we make on a daily basis. And I really don't like rules, and I don't like restrictions. I like to spin it we can find foods that you love or that you can grow to love, and life is very enjoyable. It's not doom and gloom, but nutrition is incredibly important, both to reverse and stabilize diabetes. But you won't get diabetes under control if you have the oral pathogens, and you won't get the oral pathogens under control if you have diabetes. And so there may be people listening to this say, well, phew, great, I don't have diabetes. But we now know that most of us have spikes in the blood sugar because if we've eaten a donut or we've drank a Coke or we've had some kind of Skittles out of a bag, or it could even be just carbohydrates that are healthy. But and I'll tell you, there's more than just what we eat too. You alluded to it, Aurelia, in that sleep plays a big role, stress plays a big role, exercise. There's so many factors that factor into this. But most of us are walking around pre-diabetic and don't know it. We may be very pre-diabetic, and that's called insulin resistance, where the body is trying its best, but it just continues to put out more insulin to overcome these high glucose spikes that we don't even know we're having if we don't, let's say, put on a continuous glucose monitor that you can wear for 14 days to actually get some data and see what's going on. Or you don't get a thorough blood work when you go into the doctor, we can tell from those clues as well. If you're going towards diabetes, I say, or you turn the car around and you're driving away from diabetes, it's really not hard at all to change that direction. But first, we need data. And that's where lifestyle comes in. There's just you can keep going back to the dental office and they have to do more therapies and have to go another round of whatever the treatment is because they're just working against what you're doing on a daily basis for your own health. So I say begin with the end in mind. If we think that we want to be blissfully happy, maybe riding our bicycle or playing with the grandchildren or whatever would be your favorite thing to do on your last day at 80, 90, 100 and beyond, then is this donut in front of me really worth it? And I use donuts because that's a big weakness of mine, but I haven't had one in a few years.
That's
I
good.
may actually try one, test it with, I have a continuous glucose monitor and post about it. But
Mm.
whatever it is that you love, is it worth missing 5 minutes or 5 years or 5 days of those joyful moments in life? Or as you mentioned earlier, Dr. Wade, is it worth it that you aren't cognitively, your brain isn't functioning on all cylinders when you're 80, 90, and 100 and beyond? Many people say, I don't know how long want to live, as long as I can, but as long as my brain still works.
Right.
That's a big fear we all have. And so these glucose spikes and these bacterial pathogens and all of it's intertwined are things that are slowly damaging our brain at the cellular level, as well as our heart and our blood vessels. So it's not doom and gloom. I see it the very opposite. Like if someone told me, if you eat that, you will not even be able to know your own name at age 90. Well, you can eat it once and get away with it, right? So if I used to use this with smoking. Smoking hopefully isn't as popular as it used to
Yeah.
be. Still too many people smoke. But I would say if someone's trying to quit smoking, if they really just are struggling, if they knew for a fact that you would drop dead at 100 cigarettes, they would count and they would go to 99 and they would not smoke another cigarette because they're seeing people drop dead and they're like, oh yeah, they smoked their 100 cigarette. We don't know. For each of it's different. We don't know how many donuts are going to steal our brain function or how many, awful Skittles. I don't know. I shouldn't use brand names, I guess, but packaged foods and all of this toxins that we put in our body. And they're not only toxic, but they cause our blood sugar to rise. We don't know how many it's going to take, but just think of it as a little bit of damage every time you do. Now, when I tell people go out with to eat, okay, and have the dessert, and there's some tricks to keep your blood sugar from rising so high that we can certainly help you with. So it's not like you have to, just eat lettuce the rest of your life. That's for sure.
I love it. I will echo one thing that you said. If anything that I've added to this whole thought process is sleep and breathing.
Yeah.
Sleep and breathing. I think I'm realizing, maybe because I'm a dentist and obviously that's my zone of expertise, the more and more I get into it, the more I realize that that is becoming a critical part and piece of a wellness strategy for every person. I don't care how old they are, from newborns to, like you said, 104. That sleep strategy is really going to be important and critical.
Yes. Oh, I couldn't agree more. Absolutely agree more. High quality sleep and then breathing well during sleep and all during the day. Absolutely. Because I used to go, oh, okay.
Yeah.
When people would teach that if we're mouth breathing or if we do have sleep apnea or if we snore at night or if we, are congested and we're not
Mhm.
having ideal breathing patterns, that it changes the pH of the mouth and bacteria can grow. I'm like, oh, that's interesting. I didn't realize that's life threatening. That is
Hmm.
life threatening because it's going to be harder for you to get rid of these bacteria and keep them gone, right, Dr. Wade? If
Yep.
breathing
Absolutely.
is an
Yep.
ideal, breathing and sleep, so
I
important.
agree.
Well, because it is February, Heart Health Month, we are doing everything heart in February, obviously. So if you're interested in getting your oral DNA, we have some specials. You could scan the QR code there, and get more information about it at Stonebriar Smile Design. And we also have a CIMT scanning day coming. And I would love for one of you to kind of explain that. It's an amazing diagnostic. I've had it done before. So, what,
Dina, I'll let you explain what the CIMT is because I know you do
Okay.
it so well.
yep.
I'll
Okay.
ramble on a little too long.
Well, the arteries in our neck here, the blood vessels called the carotid arteries, give the blood supply to the brain and the face. But of course, we've been talking about how important the brain is. But it's a nice, easy, close to the skin place to get a look, a peek into the blood vessels. They're fairly large blood vessels near the skin. And so ultrasound can be used, just a probe on your neck, it's painless, to look at the arteries in a very precise and detailed way. It takes a special technician and it takes a special type of ultrasound, something called B mode. That probably won't matter to anybody and that doesn't need to stick in your brain, but it's not your traditional, oh, I've had a carotid scan. Like for many, many years, we've done carotid ultrasounds. If it's just a carotid ultrasound, they're probably simply measuring flow, which is what we did for many years because nobody knew what to do if there was a little bit of plaque on the wall of the artery. But if there's a problem with blood flow, well, we can do something. We can put in a stent or new medications or whatever. That's old school. We now know we've got to look precisely at the wall of the artery, whether it's obstructing the blood flow or not, to bring us back to the beginning of our conversation to see if plaque is there. And if it's there, yeah, okay, is it blocking the flow of blood or not? We got to address that, no doubt about it. But if we're talking about stopping the disease process, reversing and stabilizing this disease, then we need to know, is it soft, about to have a blood clot forms, about to rupture like the blister or the pimple that can pop or the lesion that can start to leak? Or is it scar tissue, not ever going to cause a problem? Or is it that middle of the road, that moderately risky plaque? And that's why it needs to be a carotid. That's the C. I for intima, that's just the one of the layers of the blood vessel. Media, another layer of the blood vessel wall. Thickness test, and that's why we call it CIMT. You just lie there perfectly comfortable with the ultrasound probe, while the technician is gathering this precise data. So when you get that again in a year, that's how we can tell if we're reversing and stopping this disease process or not. Dr. Bale and Doneen have been using that for, I don't know, 30 years
Decades.
maybe.
Yeah,
They were the
decades.
first to say, hey, this is the one place we can see the wall of the artery. We now have another way to look elsewhere, but this is still, I say, the number one test because simple, easy to do, relatively inexpensive. It can be offered as you're doing at the dental office. It can be offered in an event, or
Mhm.
it's just easy, and it's saved lives in that Beldonin method for many, many years. So you can save your life if you don't get any other arterial test. Just know that
Absolutely.
you'll hear about new AI and more
Mhm.
fancier technology and stuff that's also available. This is still, we would be the first to tell you if something was old school because we're
Yeah,
first to say if there's a better
true.
way, let's do it the better way. But
True.
this is still the best way to say, how am I looking?
Hmm.
I love it because it's economical,
Yeah.
Hmm.
super easy, it's non-invasive and repeatable.
Mhm.
So I think that's why I like it too, is Some things, even in dental x-rays, it's hard to repeat the exact same position, the exact same angle every
Mhm.
single time that we do it. Okay.
Yeah,
It's the goal, but it's still hard to repeat. The nice thing about the CIMT is very repeatable. So your year after year comparison is almost identical. And they do certain things to make sure of that. So it's really comparing apples to apples, not an apple to an orange.
Hmm.
So that's where Gina and the medical professionals that practice this way, that's where they get so much value in understanding if they're reversing and what their treatments are reversing the disease process.
absolutely.
Yeah, and like you said, both of these tests are repeatable. It's something you could do every
Correct.
year.
Mhm.
And it's
And
important.
affordable.
Yeah,
Mhm.
and yeah, it's very affordable.
Mhm.
Um, anyhow, any questions out there? If anybody have any questions? I'm trying to see every time I move my thing. Um, if there's any questions, you could chat in the chat box or anything like that. But I think that if unless you want to add some more, we have, any more information, doctors?
Oh, that
Lots of,
honestly, that was the core of what I wanted to talk about
yeah,
tonight.
yeah,
And
no, it's,
it's just so good to talk about it with Gina because again, I think some of the beauty of what we're talking about tonight is that it's the medical and the dental side of things. I
mhm.
couldn't do my job without them. They can't do their job as well without us. So it is I think one of the most beautiful things about the subject matter that we're talking about,
Well, and
which is
also
saving lives.
I think that in traditional healthcare, let's just go traditional. You don't have this. I mean, I hate to call it concierge, but it kind of is. I mean, you're getting specialized treatment when you have a partnership with a dentist and a physician, and it's very rare out there. And that's what makes you guys incredibly unique. And that's why I am still with you and love what you stand for as a hygienist. Um, I feel very honored that I get to, be part of this because it's very important. And I've seen you save lives. I've seen amazing things. So I mean, it's hard to explain that to somebody that says, "Oh, the mouth and the bacteria and your heart," but it's 100% the truth. Like it's all connected. So.
Absolutely. It's all connected. Yeah.
These are the links here for Dr. Gina and Dr. Wade. If you want to actually, make a appointment, you can schedule something that it'll take you right to a consultation, right, Dr. Gina?
Mhm. Mhm.
And then, go from there. And then again, scan for any other information you need from Stonebriar Smile Design. And pretty much we can work together.
Absolutely.
Yeah.
Uh, I'll say goodbye, but certainly want to invite everybody to the February specials of oral DNA, a CIMT, Protect trays, or a cone beam. So just check it out and hope to see you in the month of love at the dental office.
Thank you guys so much for being here.
Thank you.
Okay,
Good
bye-bye.
night.
Good night.